Good afternoon and welcome to the latest episode of Home Care Hot Seat. Today, I'm delighted to be joined by Right at Home UK CEO Ken Deary and Chief Operating Officer Lucy Campbell. They'll be discussing how the company is supporting care staff after receiving a 5-star employer status, the challenges they have faced during the pandemic as a private provider, parity of esteem between the NHS and social care, and technological innovation. So you recently retained your 5-star employer status for the second year running. So in what ways have you been ensuring your caregivers, making sure that they feel supported, especially during the pandemic?
So yeah, it was absolutely fantastic to retain their 5-star employer recognition for a second consecutive year. Ensuring our caregivers feel valued and appreciated is absolutely core to the culture of Right at Home. And our rewards and recognition programme really does ensure that they really are recognised for the little things, the things that they do to go above and beyond day to day. So of course, throughout the pandemic, we wanted to ensure that they feel more appreciated than ever. As standard, they get longer shifts, and we make sure they have, adequate time to travel, which really does help to create a really positive working environment for them. And throughout the pandemic, what's been key to our support offering, perhaps more so than anything, has been the heightened communication, ensuring that they've got really clear and concise guidance. So they know exactly what to do in terms of PPE. There's been letters with small tokens of gratitude included, wellbeing calls, videos from both national office and from a local office. And I truly believe that this, together with the provision of really high quality PPE, has provided our caregivers with the assurances and the confidence to do the wonderful work which they do. Additionally, we also launched a mindfulness programme as well as streamlining our induction programme, really supporting us to take a holistic approach to supporting our caregivers through what can understandably be a little bit of a challenging time for them.
Okay. And speaking of challenging times, what are some of the main concerns that care workers, caregivers, as you call them, come to your management team during the crisis, and how have you overcome these issues?
Well, as you'll be aware, the press at times has behaved in a little bit of an alarmist way, coupled with the rapidly changing guidance around PPE for our sector. We're bound to be met with an unnerved workforce at times. So we therefore saw it as our job to bring a sense of calmness throughout our communications, providing measured updates with solid, definitive and timely updates. And I have to say the feedback that we've had has been absolutely fantastic. We've ensured that we've also been wholly sympathetic to those vulnerable members of our workforce, such as shielders, who we've been able to support through the likes of furlough. And additionally, our strategy to build resilience within the workforce has been absolutely key. So when the pandemic hit, as I mentioned before, we immediately ramped up our recruitment drive with a national advertising campaign and a hotline, redesigned our induction programme to bring around the necessary efficiencies, whilst also seeing many of our current staff members actually step up and volunteer to do excellent shifts.
Okay. And the same question applies to your clients as well. What have been their main concerns, and have you seen any or many council care visits as a result of their fears during the pandemic?
I'll take that one, Sarah. I think from a client's point of view, during the first week, safety was a real concern for all our clients, and having people go into their own homes, be it carers or anyone, really spooked them to some extent. So we did get a number of early cancellations, particularly on companionship, where clients were basically scared of anyone going in their own home. Also, the other thing that clients were scared of was our staff wearing all the PPE. So you can imagine coming in with a mask and a visor. It was quite frightening and daunting to our clients. However, here at National Office, we believe we acted quickly with clear messaging on PPE, best practice, And this really cascaded confidence, and that went down to the local offices where they're locally owned with local office staff, and they passed that on to the caregivers, who passed it on to the clients, and all the things Lucy talked about before, letters, videos, assurances, they all helped. And over the period, I think we're in week 11, are we? It's meant demand as a group has been sustained even during the pandemic. We're delighted about.
That's great news. Okay. And Lucy, you touched on the recruitment drive to fill 1,000 vacancies, which you launched in April. What has been the response been like to that so far?
You know, the response has been absolutely fantastic. We've actually been overwhelmed, particularly at the beginning of the pandemic. The number of applications we had from people who've never really worked in our sector before, who really just wanted to give something back at a time where their services were really, really needed. We've got some brilliant new additions into our teams across the country now, and quite a number of them actually want to stay within our sector. So we're confident we're going to retain quite a number of them, which is just absolutely wonderful. And it's been crucial in supporting our businesses to meet the growing demand for their services.
Okay. Would you say that you've seen more people apply to the sector than ever before?
Absolutely. I mean, prior to the pandemic, anybody within social care will tell you that recruitment has generally been the barrier to growth. But actually, throughout the pandemic, recruitment has not been nearly as challenging. We've had just a great response, and it's been wonderful to welcome so many new people into our sector where they can really, really make a difference.
Okay, that's great. What did you make of the news that MPs have voted in favour of the government's immigration bill? Because that's been quite controversial, hasn't it? And what will this mean to your business?
Given in the past, as Lucy alluded to before, demand for care has outstripped the supply of caregivers. At first, we were really disappointed. But I always go away and try and reflect on things and look at both sides. And, given that unemployment is inevitably going to rise in the UK, so that will effectively be where the government, I think, were coming from, that they need to protect the UK job market in the future. So we're hoping that with more people becoming unemployed, we hope that doesn't happen, but inevitably that's what we're being told. There will be enough people transferring over to caregiving to actually fill the void. But if we look at living caregivers, most of those come from overseas, and there's not as many available in the UK. So I do foresee that could be a difficult area, living caregivers, and we're looking at solutions in this area at the moment, alternatives. As said, with more UK residents becoming available to be caregivers, with the unemployment rate increasing, we should be able to fill that void. We hope to fill that void. But as the economy inevitably grows stronger over the years and the employment market strengthens, I'd hope the government would then revisit their decision, because otherwise it will have a really negative impact on the sector to service our clients.
Okay. Is living care an area that you'd like to expand into?
We do quite a bit of living care, mainly in the south of the country, but we do quite a bit of living care at the moment anyway, and it is a growing area.
Okay. So one of the biggest gripes care providers have voiced over the years is a lack of parity of esteem between the NHS and social care. Has the emergence of the pandemic helped to narrow that gap, do you think?
Personally, I don't think it's entirely relevant to expect parity with the NHS, because it's revered as a national institution. It covers every age, from the newborn to the elderly, even healthy people who suddenly get hurt in an accident. So parity, I don't think is the right thing. I believe social care is a great support to the NHS and stops vulnerable groups tying up the resources of the NHS, and we should be recognised for this. And yes, I believe the pandemic has raised the esteem of social care, and I hope that this increased esteem continues from both the public, who've been fantastic, and the government. The pandemic has also shown the need for more integration between the NHS and social care. You know, we can really support the NHS to free up bed space. And that integration could undoubtedly bring future savings and productivity for all.
Mm-hmm. Okay. Some leaders have argued that the majority of media coverage has been focused on care homes, and that home care really should be taking centre stage. Just like you say, home care really does support the NHS in keeping people well at home. Would you agree with that?
Well, firstly, you'll always find the positives from right at home. We always try and look at the positives. So I would say undoubtedly home care keeps people well at home and out of hospital, as we discussed before. However, given the sensationalism and some of the inaccurate reporting by some of the media and TV, I actually think home care being the quiet heroes in all of this has been a good thing. The media have effectively scared people from going into hospital, and they've scared people from going into care homes. And in the meantime, home care has gone under the radar and has benefited from being out of the media and being seen as the safest option for home care for all the right reasons. So I think it's been beneficial. We haven't been right at the forefront of everything.
That's an interesting take on it.
Yeah. Well, you know, if we look, to be fair, they've given the care homes a really tough time, haven't they? And you know, that hasn't helped care homes, you know, which is a real pity. You know, because people there have worked really hard, haven't they?
I suppose it's woken people up to the fact that the care sector does need more funding now.
Oh, undoubtedly, and that's a great thing that the public recognise what a great job we do in social care, and also the funding is a really important part. Yeah, in terms of funding, I think you had a question on that, didn't you, Sarah?
Yeah, I was going to ask you what are the biggest challenges you faced as a predominantly private funded provider, when other providers funded by local authorities have faced issues with funding.
Yeah. Well, just a few things I'd like to clarify. First, like most providers in our sector, our franchise network is made up mainly of independently owned and operated businesses working within our right at home network. And as you know, margins in the sector have to be tightly managed, and this is the same for our franchise owners. And the last point I'd like to make is that 30% plus of our work is in fact government work, so we understand the government side pretty well. And I believe a lot of the frustrations over government funding and margins could be alleviated by two things. Firstly, as the UK HCA always say, a minimum price for home care, even if this means a minimum regional price in each of the regions. However, as the UK HCA has campaigned, we cannot pay our staff as well as we would like to unless we have a better price for home care, as margins are tight in our business. And the second simple thing, and I believe this will be tied into moving out of the EEC, is by making the sector zero rated for VAT rather than exempt from VAT. That way, providers could reclaim the VAT on their expenses. And this would be an enormous help to the individual providers, but at minimum cost for the government. UKHCA have calculated they think it would be about 100 million a year across the whole of the social care sector, which really in the spends that are going on at the moment is minimum. So a minimum price for home care and zero rated VAT would alleviate margin pressure and allow us to invest in our staff and our clients' well-being, which really is our priority.
Okay. Could you expand on that, what you said about zero rated VAT, Ken? You've signed a campaign to support that, haven't you? Can you tell us a bit more about the campaign?
We've got the other major franchise providers behind the campaign to actually try and get welfare services. That's what we are, welfare services, zero rated for VAT. Currently, things like mobility aids, prescriptions, incontinence pads are all zero rated. Yet we're looking after the same group of people, and we're not zero rated. It would significantly help us. We've also worked closely with the UKHCA, who I must say have done a great job over this period. They've been fantastic to, write to the Chancellor, write to the Treasury, and really push this. And over the coming months, you'll see a lot bigger push on the VAT. We'll be pushing this at every level. Because, for minimum cost, it would help a lot of providers weather the storm that's coming up in the future in terms of costs.
Okay, thanks, Ken. So moving on to the subject of innovation, you recently launched your Right at Home Light device, the technology-enabled device across your 3 offices. How does this work, and what feedback have you had so far?
So, as you're probably aware, for an individual procuring care for the first time, it's a huge step, and often a step they're not too confident in taking. But we know that early intervention can have huge benefits, ultimately supporting our clients to remain in their homes for as long as possible, and also supporting them to remain independent, which is really at the heart of everything which we do at Right at Home. So Right at Home Light is a great way of introducing them to our services, which without being overly intrusive. So effectively what Right at Home Light enables our clients to do is to check in. There's an OK each day button that they press, and that enables us as a service to know that they are OK. And we can use that information to start to spot any unusual trends. There's also a prompting service within the technology, so if they want some regular prompts for medication, and also a messaging service as well. Now, over time, we can start to look at that data, and if there's any unusual trends which starts to transpire, it might be an indication that perhaps there's a start of some form of cognitive decline, and at which point that's a trigger point for us to have a discussion with them and their families, if appropriate, to see if they need a slightly more intensive package of care. Now, ultimately, we also know that by spotting cognitive decline earlier on, you can arrange a whole range of positive activities and support to help slow down the onset of some of the more severe symptoms associated with the likes of dementia. And so far, the response has been really, really excellent, and we have every intention of rolling that out across the network.
Okay, fantastic. How soon do you think that will be?
Well, it's imminent. As I say, it's with 3 of our franchise owners at the moment. We do want to see how it builds traction once the pandemic slows down a little bit, because obviously we're not quite in a period of normality at the moment, are we? But ultimately, we'll probably slowly start to roll that out in a few months' time.
Okay, thanks. So what other projects have you been working on over the last 6 months that you can tell us about?
Yeah, I mean, innovation and technology is key to us at Right at Home. We've got a huge emphasis on staying ahead of the curve. Obviously, we want to give our franchise owners the necessary competitive edge. And we've been working on quite a number of initiatives, some which are a little bit confidential, but just to give you a flavour of the space in which we're working, we're looking at habitual monitoring services, health checks within the community, and also something which I feel particularly passionate about is technology, which helps to reduce the feeling of isolation and look to tackle loneliness for our clients.
Okay, that's really important, particularly now.
Yeah, absolutely.
Okay. And finally, what are your predictions for the home care sector post-pandemic?
Really positive for two main reasons. Recruitment is getting easier, and you know this sector has tended to do well during the recession because we can recruit easier. And second thing is demand is going to be there, isn't it? Because what we're seeing now is people are wary of staying in hospital, also wary of going into a care home. So the demand has got to go one way. So that can only be positive. Biggest concern we talked about was margins, and undoubtedly there'll be some fallout of providers for those who are working on extremely tight margins. However, for those who do manage their business through the pandemic, I see the future as really positive. You know, and the public have really embraced the sector. For example, the clap for carers has been fantastic, you know, really uplifting. And if the government invests in the sector through minimum price for home care and zero rated VAT, this will allow us to provide the highest quality care possible to our clients, and really importantly, reward our fabulous staff in the way they deserve. So I see a really positive future for home care.